I'm Donna Sollenberger, for those of you who don't know me. I'm the Executive Vice President and CEO for the health system, and I'm going to kick off Mondays in March this year. So I hope that you enjoy what I've been able to put together for you with the help of many, many people. First, I want to thank you for taking the time to do this. I think that Dr. Calendar has created a very important venue for us to, halfway through the fiscal year, kind of check in and see how we're doing, but also look at the future and be able to see what's in our horizon and beyond. I also wanted to acknowledge this is the 6th year I've done this. This is my 6th Mondays in March, which kind of seems unbelievable, but I was thinking as I watched people come in how reassuring it is to see so many familiar faces and to realize that I've met some pretty incredible people in the past 6 years, and it's been a real pleasure being able to work with each of you, as well as our folks who are joining us either by computer because they need to stay at their desk, but they're able to watch this being streamed. And we also have it coming from Victory Lakes, as well as our new colleagues in Angleton, Danbury. So to those of you who are watching via these other means, I want to welcome you as well. And although I don't see you, I know that you're there, and I appreciate the time that you're taking. I first wanted to mention that I would love to tell you all of the accomplishments of the past year, but it is so many that we have done again this year what we've done in past years, so that we try not to, so that we make sure we acknowledge everybody's good effort. But on the website the health system website is our updated list of accomplishments. I have partnered with the Department of Ophthalmology because the print is so small. But it's hard to put everything in that really recognizes all of the great work that's going. Hard to put it in this presentation, but suffice it to say, we have a lot of great people who have worked very hard over the past 6 years, and in particular, so far this year, to achieve some of the stunning results that we're going to see. Also wanted you to know I haven't decided to just be casual and informal here. I have a bad knee, and so I'm trying not to walk around, especially when my boss is in the room. Because he was not happy with me walking around last week, so now I have 2 aids, and I'm learning to deal with crutches. It's not. I wish it were something really exciting, like I was running a marathon and partially tore my meniscus. Actually, it was an ultra marathon. Okay, I missed a step. So it was a real graceful move. But at any rate, I wanted to do something this time, and that's to go back and look at 2 years ago. I think Dr. Jacobs was fairly new, and we decided that we were going to look forward to the years 2018 to 2020 and say, where would we be by then? And so what I attempted to do for this Mondays in March is pull out those bold statements that we made and attempt to show you some of the great progress that's been made. Because I remember after that presentation, I had several people say, well, those are really lofty goals, but do you think it's possible for us to get there by 2018 to 2020? And I said, definitely. And I think as I put this together even, I was astonished at how much progress we're making to build a very bright future for UTMB. So let's get started. I wanted to ground our conversation in the mission, vision, and values. We all know our mission is to improve the health for people of Texas and around the world, and that our vision is we want to work together to work wonders as we define the future of healthcare and strive to be the best in all of our endeavors. Our values ground us in the work that we do. They are guides for how we are to work with our patients, our customers, in each other as we do this great work that we are embarked on. And the first is we show compassion for everyone, that we always act with integrity, honestly. People can count on us for that. We show respect for everyone we meet, no matter what the circumstances or how different they are from us. We always show respect. We embrace diversity to serve a global community, because one of the things UTMB has a rich and should be proud history is really serving the underserved in patient care, but also having astonishing results leading the nation in the diversity of students that we graduate. And I think that's one of the real hallmarks of UTMB and one of the reasons that I am so proud to work here. And finally, we promote excellence and innovation through our lifelong learning. We are, after all, an academic center. So when I look at the mission, vision, and values, I think, though, there's one piece missing. And as I was doing this, I found my old friend Russell Crowe on YouTube, and I decided to let him help us figure out.
I need a map.
And we have a map as well, just like he needed a map. And sometimes I know I hear as I go around people saying, well, what is it we're trying to do in the future? What is it we're trying to become? And really, today I want to focus on the road ahead, and help us keep going back to that is really our guide for where we are headed and what we need to do in the future. I'm going to start with a slide I had 2 years ago about healthcare reform. And I think everyone in healthcare is struggling with the fact that revenues are going down. We have to try to manage the costs at a time when we have more technology, more solutions available to us, but they are expensive. And so how do we decide and make priorities around all of the options that are available to us? Because we're going to have continued pressure to reduce our costs, but we know we're going to have increasing expenses that we actually need to provide some of these future solutions. We're facing workforce shortages that will, I think, as the population ages, will become greater. And we've been in a tremendous growth phase, so we've needed to have more and more of our important and yet hard to find healthcare workers. We've had significant investments that we make in IT, and we know that those are going to be leveraged to pay off. And increasingly, our patients that we see are more complex. Patients that oftentimes, and I see some of our wonderful nurses in the audience, patients who used to be in ICUs are now on the acute care floor, right? They're nodding. So the patients that are in the ICU are exceedingly complex. We know that the nation is faced with shrinking margins as there's pressure on both our cost going to manage them so they don't go up rapidly, but also the decreasing revenue, and declining or stagnant patient care revenue, which I'm going to show you a few things where we have been able so far to avoid some of that hit, but I think that we do need to be cognizant of it as we move along. We also know healthcare reform is going to require many things, increasing access. When do patients want to be seen? When it's anytime, right? Or when it's convenient for them. And if we work Monday through Friday, 8 to 5 in our outpatient centers, that may or may not always be ideal for the patient. I know I see Dr. Richardson, our chair of pediatrics, in the audience, and she has recognized this with our own precious patients, little patients. And even though we have urgent care, she's looked at how can we maybe keep pediatric primary care and specialty care up in Bay Colony open maybe some extended hours or on Saturdays to make the services we have accessible to parents who are trying to balance work and their children and their children's health. We know we have engaged consumers with higher expectations. We get more calls than ever before wanting us to quote how much something is going to cost. And I see the revenue cycle people here, and they're nodding their heads because patients are getting a bigger and bigger burden of the cost placed on them. So they want to make sure that they're getting, from their minds, the best value, both in terms of cost and quality. We have new delivery system models that emphasize teams and coordinating care, and we'll begin using more and more telehealth and seeing patients in non-traditional settings, and we're going to talk about some of those in a minute. More interprofessional care. It's no longer a work in silos of the doctor does this work and then the nurses do this work and the therapists do this work. It's really working in teams to come around and understand the patient. And Dr. Thompson, who's also here, our chair of family medicine, recognized this in terms of we really ought to try to establish some patient-centered medical homes. And that's really focusing on a team at our clinic that knows the patient, even though, so there'd be a couple of doctors on the team, a couple of nurses, so those folks always know the patient, even if that physician isn't in clinic that day. And I'll tell you a little bit about that, but we're making some good progress. We also know there's increased funding for population health management and outcomes research, and we have some work we're doing around that so we can access those dollars. As NIH funding declines, we're seeing, though, there are more dollars that are available for this type of work. And I know that Laura Rudkin, and I don't know if Dr. Rudkin is here, her department is focused on that, but we're doing it partnered with the health system and the School of Medicine. And then we need to think about contemporary care models for educating all of our students. You saw this last time as well. The group of circles on the left shows really 2 years ago my impression of how we were working. And while there were some intersections, as you can see by the dark shaded areas, we weren't working necessarily as closely together as the future was required. And if you look to the right, you're going to see really by, I'm calling it UTMB Health 2018, what we really need to do. And you see those intersections are greater and greater, so the lines get blurred. And we're really moving from, I was thinking, how do I describe this? And I think what we're moving from is a situation where I'm thinking about what's the best thing for my department. Okay, and I know that department heads and department managers and department chairs that are here are probably saying yes. But we need to, in the future, be moving toward what's the best decision for UTMB Health, because the lines are becoming blurred. And I want to make a decision that's good for the health system, but when I talk to my colleague, Dr. Jacobs in the school, I may realize that the best value is to use his idea because overall it's better for UTMB Health. And sometimes that's hard to do because I know my business pretty well. You don't have to respond to that. But I know my business pretty well, and I think this would be really good for me. But I have to constantly think, and I ask myself this all the time, am I making the best decision in the interest of UTMB Health? And kind of keep that in the back of your mind as we go along. So we have a plan. It's called The Road Ahead, and you individually play an integral part. We've been doing some streamlining. In FY14, the health system strategic annual operating plan had 1 mission, 5 pillars, 5 goals, 25 strategies, and 70 tactics. People were saying, we're worn out. And then you look at this and you're saying, I see why. So we've worked hard to reduce this so that we've aligned our pillars within the health system to be the UTMB pillars, to send the message, we are all one. 4 goals, we pared it down to last year with a lot of effort. 8 strategies, and then below those strategies, 58 things we would do this year. We're working to make that even slimmer in the coming year because we have some work that we know is going to be on our plate. Think opening a couple of hospitals and a couple of big clinics. So we need to make sure that we're very targeted and focused in the work that we're doing. So our first pillar is people. And in our people pillar, we want to invest in the success of our workforce. Why would this be the first thing that we would mention? Because we can have the best plan in the world, but if we don't have good people, that plan is ineffective. And so we need to make sure that we are retaining, hiring, and investing in the people that are going to make UTMB work and be successful in the future. So what are some of the things that we are doing? We're working with HR. You're going to hear a lot of working with because it goes back to this isn't just for the health system. This is really about everybody working together. Hiring and retaining the right staff that exemplify our values. We are trying to help our employees understand and articulate their impact for us in the health system on the patient experience. Nurses understand that, doctors understand that, but how do we help that individual who brings food to the room or cleans the room, or even the person who works in research who happens to see a person who turns out to be a patient who's concerned or confused about where they're supposed to go. We need to make sure that we have an environment that focuses on improvement, is an environment that is underpinned by trust, and that we openly report and resolve issues. Have you ever had one of those personality assessments done about kind of what your strengths are? You know, some people are planners, and some people are tactical, implementers, and so forth. Well, I really think that I'm a doer. I like to get things done, okay? Sometimes I get frustrated with myself about I'm not maybe navigating this as well as I could, but I really want to get things done, and so that knowing what the issues are and being able to resolve them is really important to me. And so hopefully we want to instill that in all of our workforce. We want to competitively compensate our employees. We want to make sure we're paying market rates for market pay for market work. We want to, where we can, have a merit program. It was just announced a week or so ago that we are going to implement that program. It was implemented as of March 1. We also want to invest in training for current and future roles. We've worked with, I know the Operations Council in the health system has worked with HR. The executive leadership is working with HR and identifying good opportunities for training. And we want to make sure that we're engaging the state and the Texas Department of Criminal Justice in needed investments for correctional managed care. We know that in some instances we have fallen behind market, and we have in our requests to the legislature, we are requesting to make the needed adjustments to bring those employees more in line with the market pay. We also need additional equipment to make the work better, and I have personally been out and seen their equipment, and I couldn't agree more with what their priorities are. So we need to make sure that we do all we can to make that investment in a group of employees that are very far away from us many times, but very much a part of UTMB. The bottom line is we want people to understand that you are our greatest asset. Does everybody every day feel like that? I would imagine with 12,000 and some employees, the answer to that is no. But we want to, for the most part, have people really understand that without them, this work could not get done, and we want to invest in you so you can do it. We also, how many of you, well, I don't know if it's fair. If you feel like answering, you can. How many of you participated in the UCount survey a couple of years ago? Yeah, so did I. And what we tried to do at executive leadership was look at the results and say, what are the things that are going to make the biggest difference for us if we focus on them? One area that you told us we could perform better in was different levels of UTMB employees from the front line to senior management communicate effectively with each other. And you pointed out that we could do better in the health system. And one of the things that we did is we tried to increase our internal communications. We just started with the rest of the organization, the weekly relay messages, so hopefully you're starting to hear those from your supervisor or manager, but just quick snapshots of what the institution and the health system and your department are going to be focusing on that week. We have Impact, which our friends in marketing and communications do, the Friday Focus newsletter, and the Friday Flash reports. And hopefully you have a chance. I know it's so hard to find time to read all the things that come across, but hopefully you've picked the things that give you the information in the format that you like best. We also want to make sure that they're consistent messages from managers, which is why Dr. Callender and Steve Campbell helped create this weekly relay messaging for the managers. You wanted increased visibility through shadowing and rounding, which we have tried to do. I know Deb McGrew on the operations side, you'll see her out and about, as well as folks that work in the health system. I'm guessing that Deb and Ann O'Connell are shadowing or rounding today. And the reason I know that is they aren't dressed like me. They're dressed like you guys, for the nurses. I mean, in the uniforms. And so we're trying to do that because that's a great way to hear what your concerns are, what your challenges are. I've gone out to a number of the health facilities within the prison units, and it's great because I hear what their challenges are. And you know what? If I'd just guessed, I would have been wrong. You really need to hear it if you're a manager from the folks that are working with you. You need to go sit and do their work for a little bit to realize maybe some of the challenges they're having to overcome to be able to get this work done. We have also had the EAC members inform our work. I saw some of the EAC folks. There you are. They're doing great work for us in that they represent you, and so when we have different forums like today, they'll send out a request for questions. They also are visiting all of our different facilities in our health system, and they have given us quarterly, they meet with us and give us the feedback, what's on your mind? And that's been another rich way that we've been able to do this work. And then the unit-based clinical leadership and ambulatory-based clinical leadership, which is rolling out, which is this partnership of a nurse manager and a physician in really managing the unit and the clinics to be able to make sure that communication is more effective. But we continue to ask and love to get your thoughts on, what's effective that we're doing and what could we do that would be more effective. So always feel free. I answer my emails usually on a pretty regular basis, and I love to hear from people about things they're seeing that we could do better. People also want to work in an environment that makes them want to go above and beyond what's expected of them. We've done a number of things in terms of recognition from the David Marshall and nursing have had the Daisy and Silent Angel Awards for some time. I know when I go to them, I always grab a box of tissue because the stories are so amazing and so really demonstrate the compassion that we have for our patients. But David and Ann O'Connell have started the Always Award, and this is given quarterly to the clinic and to the inpatient unit that always demonstrate consistency in patient satisfaction. How important is that? We've also looked at compensation and staffing, working with our colleagues in HR about what jobs are falling behind the market, how are we going to address that. In fact, tomorrow we get to sit down with them again to talk about some of these things. And then staffing, I know in nursing, if you've seen our census in the inpatient side, it's gone up substantially. And so we've reassessed the nursing positions that we need, and we've just released some additional positions to help with that. So we are trying to look at that. Are these always going to be positions that the position you wanted? Probably, maybe not, maybe so. But we are looking at that and trying to respond to what the data is telling us in terms of the number of patients that we're seeing. And they also talk about they need a greater ease of working with departments that I depend on to complete my work. Oftentimes not in the health system, or if you're in institutional support, oftentimes not just there. But we need to collaboratively work together. So I pose a question. How do you want to be recognized? Are we addressing that through the holiday reception and the employee week and some of these things I've mentioned here? But if you have ideas, again, share those with it. But I want you to ask, as you go about your work, I want you to ask, what can I do to make it easier for you to do your work? And every employee at UTMB should ask this. What can I do every day to make it easier for my colleague or colleagues to do their work? And that goes back to that whole issue of teamwork and recognizing the challenges and obstacles that we sometimes all face, and how can we do a good job of overcoming those. I'm not going through all of these, but we've had some wonderful recognition from outside organizations about the great work that goes on here. In the nursing excellence category, the Good Samaritan Foundation gives gold, silver, and bronze awards. And we had a gold medal winner. Jamie, are you here? Jamie Heffernan? There she is, our gold medal winner this year from all of the hospitals in the greater Houston area. So congratulations, Jamie. And is Chuck Mockner here? There he is, not too far from the gold. He got the silver, a silver award from the same organization. So congratulations to you too, Chuck. These are big awards, folks, and they really speak volumes to the great people that we have. Many organizations go year to year and don't have any. We have had some in School of Nursing as well, not to leave you out, but those folks really have done a tremendous job. The other thing we're a state-designated Ebola treatment center now as well, and we've been working on some grants and so forth, and I wanted to recognize Christine Wade and Dr. Scott Lee, Dr. Mayhall, who, along with many, many others, spent lots of hours, extra hours, trying to make sure that we would be ready, if necessary, to take a patient. The other thing we want to do is be a value-driven organization. Remember, value is cost plus quality equals value. And so we want to deliver high-quality outcomes that improve education, research, and healthcare delivery, that really improve our total mission. And to do that, this is really a slide that I happily use, that Mark Kirschbaum has used in other presentations, but it really shows that intersection of all the things you have to do to really get the value that we want, from using evidence-based practice to shared decision-making through interprofessional work, clinical outcomes that are exceptional, data-driven, continuously monitoring through dashboards and accessible data, and appropriate use of resources to make sure that we are providing the most effective care at the best cost. So to do that, I'm doing a little then and now. This is what I said 2 years ago. This is what we're seeing now. I said care delivery has changed for the better, and we're doing more and more. We're integrating more of our clinical records, more of our clinics are online, more of our specialty modules have been implemented. I saw Dr. Urban. I want to thank him for leading some redesign of the inpatient areas within internal medicine to try to address some of the issues and concerns our patients had. And although that was, I think that's difficult work, I think our folks have done a good job and continue to look at how to refine it. I mentioned the leadership dyads. We were going to be a patient and family-centered care organization. So now we have 68,000 active MyChart, or 63,000 MyChart users. We continue our work in event apology and disclosure. If there is a mistake, we tell the patient and their family. And a lot of work has been done to make us more accessible by simply answering the phone. When someone calls, to answer the phone and try to help them get the appointment that they need. And our call abandonment rate had crept way up, and we have now worked hard to get it down again. And we've had a lot of help from our colleagues, our physician colleagues as well. And then I mentioned that difference in how we deliver care. So the patient-centered medical home, if I'm a patient, I have a team. I have a couple of doctors, a nurse, maybe a social worker, care manager, people who know me. So if I get sick on a day that one of the team members doesn't happen to be there, there are people who still know me. Well, that's a big model nationally called the patient-centered medical home. And we have worked hard to get level 3 NCQA certification for our clinics. And we just learned, so our family medicine clinics achieved that, and we just learned a couple weeks ago, Dr. Giudice shared the information that we have gotten that designation with several of our community-based clinics. So this is recognition for working with that model. We're going to be doing more work on it to make sure we're getting the outcomes that we want. And then we have been working with some of the Medicaid waiver plans. We have done some work on trying to integrate mental health into primary care. And why would that be? Does anybody know why that would be important? Well, I read that up to 60% of primary care visits, the patient has a diagnosis that involves mental health illness. So, you know, it's very important that we try to integrate those resources so we give the best service to patients. And then there's more we can do in telemedicine, telehealth. We did over 100,000 telemedicine visits last year with our correctional managed care colleagues. We're one of the biggest telehealth providers in the nation. And so what we're trying to do now is let's translate that to doing that with more of our remote sites that we work with in ways where it becomes beneficial and gives patients out there access to what they might not otherwise have. So there's more work that's being done on trying to make us more accessible. Advanced illness management, we will become very good at that. We've done some work around group visits with our diabetic patients, and we are still working on, with again the DISRIP, trying to improve our palliative care consults. We want to be a top quartile quality performer, eliminating preventable deaths and readmissions. That was a statement we made 2 years ago. This is the one where you're going to see a lot of emphasis this year, because we need to do more and more and more of this, because we need to be able to demonstrate our value to our patients. And so it's patient satisfaction, it's mortality, it's length of stay, it's readmissions, it's all of this. And we need to have not a sawtooth in performance, but a trajectory of upward performance, much like we have in many, many other areas. And so there'll be a lot of emphasis on that. UTMB embraces a culture of trust. We're working in teams at what can I do to help make you successful? What do I need to do as I work in a team with you? And then population health accounting is going to help us prepare for accountable care. We have implemented 5 disease registries, which are needed for asthma and heart failure and diabetes and so forth, that help us be able to have data available for about our patients, but it also eventually becomes available for research and some of those other funds that I was talking about. We've completed a strategic and tactical plan for population health, and now I think this is a Texas saying, we need to get her done. And so we're going to work on that. And we've done some planning around care bundles where you say, I'm going to take and oftentimes pre-procedure, procedure, and post-procedure costs, and say, I'll give you a set price. So we're doing some work in that because we think that more of that's going to come along. So I asked the question, as I've been asking questions throughout, can you define what your role is in creating value for our patients? What are you doing that makes our patients understand that they're getting the quality at the cost that they would expect? Technology had a then and now. We said it's going to support our work and make us more efficient, and it had to have its own slide, Todd, and George, because we have done so many things with developing care protocols in the last 2 years. We're going to make Epic easier to use for our clinical providers. We've made administering medication safer by implementing barcoding. In fact, I was reading the weekend report. I don't know if anybody's here from the emergency room, but we were having trouble with the scanners, and we were trying to look for solutions for that because people rely on it now. It helps you know you're giving the right med to the right patient at the right time, so of course we want to do that. We've begun integrating devices that I can monitor and as a patient and then upload, and my doctor sees this. We've got a pilot going on there. We need to use simulation regularly for training, and have been working with Dr. Brown on how we might use some of those resources to simulate different types of important workflows that we need. We have OR controls completely up in the John Seeley operating rooms, and we'll be implementing it in the Victory Lake operating rooms as well. And this is an efficiency mechanism that allows me to use a touch screen instead of calling. And so it's an efficiency, it's a time saver, and I see some nurses who may have used it because they're agreeing with me. And this is the one I wanted to emphasize. We have, over the past 3 years, in the health system alone, invested $64 million in new equipment, either with the hospitals and clinics or the CMC. And this is equipment that makes it safer to deliver care, supports some of the new procedures and techniques that we develop here. So it allows us to advance our innovation. Growth. Some people say, well, why did we bring Angleton Danbury into the fold, and why are we, having a physician in Lake Jackson join us on our faculty? Why are we opening that clinic in North Texas City. Well, we want to make sure that we can find the greatest opportunities that help us to define the future of healthcare. And to do that, we want to be the region's preferred integrated health system. Every day, I look out the window and I can see the Jenny Seeley Hospital. And I can't wait for it to open. I am so excited about that. But I'm also a little nervous because I see how big it is and I want to make sure we've done everything we can to have the patients in there that we need. So we have been, as an anchor in Medicaid waiver, we have played a very large role in not only coordinating work across the region that has helped us leverage relationships for other things. And so we now have, for example, I won't go through all of them, but we became familiar with Baptist Beaumont Hospital, who are part of this region. They had a need in radiation oncology. We have been able to deliver a contract to provide that need. So those are the things that we're looking at, is how do we create those relationships. We've implemented MyChart, which our patients love, and we've also implemented HealthLink over the last 2 years, so that as a physician, if I'm Donna Sollenberger's physician and I admit Donna Sollenberger to the UTMB hospital, I have a portal where I can understand what's happening to her every day. I can see those notes. That's a huge satisfier for our referring physicians. We've done Just Say Yes for our hospital transfers, unless on a few occasions, and there was some this weekend, we are so full we cannot safely take another patient. But we are more often than not saying yes, and you'll see some great statistics that have come up as a result. We've implemented Care Everywhere. I show up, I travel to Los Angeles to visit my son. I show up at UCLA emergency room and I need something. They use Epic. What can they do? They can request my records. Once I sign off, it's okay. And they can see my record. They can make better decisions about me because they see what my care has been. And then we have implemented our access improvement plans that Ann O'Connell and Rex McCollum are working on to try to make sure that we have similarly good and reasonable access with our clinics. So we said we'd have new partners in care. I've listed a number in just 2 years that we have developed relationships with. Some people say, well, how are we deciding on those? Well, we're looking at, does this opportunity increase opportunities for education? Could we place students there, residents there? Does it improve population management and it gives us access to patients we otherwise might not have access to? Does it add value to UTMB and to the community that this venture, this business would serve? Does it increase access to clinical trials for patients, bringing out to them things that they would normally have to come to an academic center to be able to do? Does it meet the community need for physicians and services? So those are kind of screens that we go through just to say, yeah, let's go ahead and look at this. If it doesn't meet it, we may not go ahead and pursue it. So what have we done to extend our brand and our services? Because I said in that presentation 2 years ago, we would continue to expand our brand. How many of you seen our billboards and our television ads? But we've also, look at all the services that have been implemented in the last 2 years, all of which are going to further support our patients. And I'm looking at, so I'm thinking, how do you make connections? Why was it important to, I'm going to pick on him because he's right in front of me. Why was it important to recruit Dr. Bardwaj? Well, chair of neurology, he can help us really get that neurosciences program in partnership with neurosurgery going. So since he's been here, and he tells me he's very tired. He's opened the neurosciences critical care unit. We have an epilepsy monitoring unit. We've done so much in neurosciences, and we've seen a huge increase in our market share or in the number of patients we're treating. Market share doesn't move as fast because the numbers are so big. But we've done all of this, and we have expanded our brand. More and more people know us. We said we were going to become more cost-effective, effectively manage our transitions from inpatient to outpatient to home, and we would get more same-day appointments, particularly in primary care. And look at the numbers there, the things that we've done, how many people we've trained in really good techniques for efficient care, the work that we're doing around Epic. We're going to be patient-centric. We've done lots of work on intuitive wayfinding, my chart, a single bill, so you're not getting all these bills. We get a single bill each month. All of this work has been done just in the last 2 years to help us meet that future vision. We said UTMB employees would use us, and look at the number of employees and their dependents for the visits that we've had. Well, this would be FY14. We're not done with 15. And then convenient care, which Dr. Thompson said, well, we should have a clinic where if an employee needs to be seen that day, we'll do that. And I said, well, if we do it on the mainland, we'll need one on the island, or on the island, we need it on the mainland. She goes, we'll do both. And so that's what we're doing. And we've had about 80 patients a month accessing those slots in the employee access to care, trying to get more and more convenience for them. So questions we ask is how rapidly can we grow and still assure access and excellence? Or, as Dr. Urban said in a meeting I was at recently, and it really struck a chord, how can I make UTMB feel like a small physician practice? Not some big kind of black hole. And that really resonated. So I'm thinking about, as we do this work, how can we do that? How can we make a patient feel that they can connect better with us, that we're not some big amorphous glob that someone has to try to navigate their way through. So we're going to be thinking about how we do that in the coming year. I just put in some, what I call a reality check. Look at the U.S., look at western, southern states, and then look at UTMB. Look at admissions. What's happening across the country with admissions? They're going down. Look at us. That's unheard of. I don't even tell my colleagues this for fear they'll start looking at our market and, and learn our secrets. But we have been on a huge growth trajectory. Nobody's seeing this kind of growth, and it's because we've got great people. We're doing targeted recruitment. Thank you, Dr. Jacobs. And we're getting, our leaders are really engaged in making sure that we're seeing this kind of growth. Look at our surgeries. I mean, everything we're doing is exceeding the national averages. It's exceeding the western, southern states. So if you don't do anything when this is posted on the intranet, I hate to say print this out, Todd, but I'm going to. Print this out and stick it in your workplace to remind you every day this hard work is paying off. And yes, we're tired. And yes, we feel like we're doing a million things, but look what's happening. It's securing that future that we need. So opening soon and extending our brand, the CSW, and I'm not going to go into this a lot because Cheryl Sadrow, when she does hers, is probably going to go through more of these. The League City Hospital opens in August of 2015. First question I asked to Dr. Callender is, why don't we have a hospital up there? That was about 6 years ago, and we're to that point. It's getting ready to open thanks to a lot of people's good work. The Jenny Seeley Hospital, if my Mondays in March is past March 1st next year, just think about it. We'll be in there. We'll be seeing patients in there. What a huge redefining statement for UTMB, both of these hospitals. And then finally, we need to have resources to support our work. I said that we'd be a cost-effective organization poised for success. We're implementing a new budget system that's going to give us better information, integrating our systems so we better understand our costs, strategically adding positions to achieve the plan, faculty, staff, nurses, clinical folks, and yes, occasionally we will add an administrative person, because as that grows, we also have to have the breadth of that grow as well. We've tried to be in the health system, I think, and I think throughout UTMB, as good as we can, but occasionally you're going to see that. But we're also, if you look at the rate of growth of other positions, they're pretty remarkable because they're needed to address this growth. And year over year, your health system since FY10 has been producing or performing better than the budget. And so kudos to all of you who have made that happen by making a patient feel welcome, by responding to that patient's need, by taking their phone calls, by answering their call buttons, by being the UTMB we all want. And I can't thank you enough for that. We also will be implementing our share of the $100 million improvement plan. I know when you hear that said, I'll be honest, before I was in a leadership role, I would think, oh yeah, they really are going to cut they're going to cut. We are going to try to achieve this by doing better the things that we're doing, and we have a plan that we can improve our margin, and that's really going to be the focus of what we're attempting to do. Finally, people have said to me, why are we spending money when we need to improve our financial position? It's because we need to, I hope after you've heard this, we need to invest in our people. We need the best people, and to get them and keep them, or to keep them, as I like to say, and get them, because keep is very important, the most important. We need to invest in them. We need to invest in growth. Look what the investment in that growth has done for UTMB. That is different than any place else in the country, virtually. Not any place, but the averages were much better. We need to invest in facilities and infrastructure to support our work. Look at the operating rooms every day. It's like an orchestra, orchestrating equipment in, equipment out, so that the cases can get done. We need to invest in that facility and infrastructure, and we must invest in technology, because the future is really having easy access to data and turning that data into actionable information. It is an investment in our future. So I'm going to end with our bold vision. UTMB is a patient-centered, highly reliable, value-driven organization. It's the first choice in the region for patients, physicians, and employees, and an exceptional value to payers and businesses, and a state and national leader in care delivery. We're on our way, and I hope by hearing this that you have a sense of, it creates a sense of calm, because lots of places need to panic. I look at this, we don't. We just need to stay the course. So thanks to all of you, every one of you here listening and who will watch this being streamed later. Thank you to every one of you. You should walk out of here feeling very, very good, no matter what your role, no matter what you do every day. You made this happen. And I can't thank you enough, so thank you. We do have a little bit of time for questions. I will ask, since we have people in from remote sites, that we use the microphone. So are there any questions? I know the EAC had a couple that they could... thank you.
Hi, everyone. My name's Dawn Meyer, and I'm the newly elected representative for the hospital and clinics. And the first question that was submitted through the EAC blog was, why doesn't UTMB have an adult urgent care clinic on the island? My family and I use the pediatric urgent care clinic on a regular basis and would love to have UTMB adult urgent care to go to.
And Ann O'Connell had provided that answer, but if you don't mind, so you don't have to get out and find the, our plans are with, some of you know that the Sealy and Smith Foundation has very generously purchased some land over on Central City Boulevard behind Randall's off of 61st. And plans are, as we bring that up, that we would have adult urgent care at that site. So more to come, but that is definitely a need, and we agree. And was there another question?
Yes, ma'am, there was. What will the building that is being erected at the corner of Holiday Drive and Texas Avenue be next to Bethel Hall?
Well, I'm going to let Jake Wolf, who's our trustee project director of health system projects, and Jim Victor works with us too, but I was saving you the walk to the microphone because I think you've got the same issue I do today. But Jake's going to tell you it's the east plant, but let him tell you a little bit about it. It's pretty remarkable.
So that building is going to be the new East Chilled Water Plant. And the plant will be a major component of the district heating and cooling loop that will help serve Jenny. And I have some statistics on it. It will house 7,000 tons of chilled water production equipment, 2 million gallons of thermal storage, and 7.5 megawatts of cogeneration equipment.
Pretty, yeah. So whoever asked that, that's a pretty important building, because just like we can't get anything done without our people, we won't be able to function without that plant coming online and being part of our larger system of utility distribution in the campus. Have time for one more question, if anybody has one. One more? Could you use the microphone, please?
Sure. And it's my personal observation that in the last couple of years I've been seeing that we have either retired or the more senior faculties left, and instead they've been replaced with the more junior faculties. And if that is the case, this is my personal observation, if that is the case, and I want to emphasize the importance of junior faculty development, and we have some infrastructures here already set, and if that is the situation, should we look into increasing the resources for that matter, actually?
My bias is that we have started some with the Physician Leadership Academy. I think there are more resources we can put into all training for everyone, but I think you make a good point. Anytime we have new to practice folks coming in, whether they're faculty or nurses, we need to provide an infrastructure to help them grow and develop some of their leadership skills, because with or without titles, we're all leaders. We all influence, and being able to know those techniques, I think, is important. I see Ian Barrett from HR here. I did see Ron. Ron's somewhere. There he is. Oh, there you are, behind George, kind of like. But we are investing. We've got the Physician Leadership Academy, and I know that they're looking at, one of the things I'd like to see us do is some investment in interprofessional team development, because that's really the future of how we're going to work. And so I think that's kind of a next step that we're thinking about, but more to come, because I know there are plans for continuing to provide development opportunities for our faculty as well as all of our employees. So thank you for asking. I want to let you go straight up at 1, but thank you for coming, and I appreciate your attention.
UTMB Health, working together to work wonders.